Despite another round of tough losses for Bernie Sanders last night, including in the battleground state of Michigan, he announced today he is not going anywhere.
Last night, obviously, was not a good night. I cannot tell you how many people our campaign has spoken to who have said, and I quote, "I like what your campaign stands for, but I'm going to vote for Joe Biden because I think Joe is the best candidate to defeat Donald Trump." Needless to say, I strongly disagree with that assertion. On Sunday night, in the first one-on-one debate of this campaign, the American people will have the opportunity to see which candidate is best positioned to accomplish that goal.
But as the primary process plays out, it's taking a back seat to coronavirus. Whether it's fears or frustrations, everywhere you turn, it's just about the only thing people are talking about. And earlier today, the World Health Organization officially declared it a global pandemic with more than 100 countries affected.
In the days and weeks ahead, we expect to see the number of cases, the number of deaths, and the number of affected countries climb even higher. And we're deeply concerned both by the alarming levels of spread and severity and by the alarming levels of inaction.
Here in the U.S., more than 30 people have died and at least 1,000 cases have been officially confirmed, with many more still awaiting test results. So, where do we go from here? Joined now by Eric McNulty. He is the Associate Director of the National Preparedness Leadership Initiative. It's a joint program of Harvard's Chan School of Public Health and the Kennedy School of Government. Good to meet you, Eric. Thanks for being here. State Representative Jon Santiago is back. He's an ER doctor at Boston Medical Center who serves on the Joint Committee on Public Health, among others, at the State House. Good to see you, Doctor.
Happy to be here.
Was an epidemic. It's now a pandemic. That doesn't change anything for healthcare professionals or for me, does it?
No, it's more a rating of scope and scale to say it's very broad and going to be here for a while, but no, it doesn't affect anything in the short term.
The only way it may affect people like me is it's scarier, right?
Well, the bottom line is that the feds have been slow and sluggish in their response, and the states really have to pick up their game. And as someone who spends their nights in the emergency department treating patients and their days on Beacon Hill representing, part of Boston, the oath I took to protect the public health has never been more relevant than right now. And this past week, I've received a whole host of calls from constituents, patients, scared, nervous about this. What's going to happen in the next 2 days, 2 weeks? And I am seeing that the state is moving forward on a whole host of initiatives.
Well, I want to talk about where it's going to be in the next couple of weeks. As I mentioned, 1,000 confirmed cases here. And here's Anthony Fauci, Director of the National Institute of Allergy and Infectious Diseases, earlier today.
Bottom line, it's going to get worse. How much worse we'll get will depend on our ability to do two things: to contain the influx of people who are infected coming from the outside, and the ability to contain and mitigate within our own country.
I'm sure you read today that Chancellor Angela Merkel from Germany has said she can see it likely to infect at least 2/3 of the people of Germany. Are we looking at that here in the United States?
Well, I would agree with Fauci. It's definitely going to get worse before it gets better. And we need to do what we can as medical professionals and as legislators to get ahead of the game.
But 70% is not worse. 70% is virtually the whole population. Mm-hmm. Is that likely in our future here?
Well, we'll see what the data suggests and what the modeling suggests, but we'll see what happens.
She being hyperbolic?
Yeah.
No, I think they're saying 40 to 70%, and it really depends on how good a job we do containing it and how well people comply with requests to avoid large gatherings, for example, to take care of the basic public health hygiene.
Speaking of large gatherings, you're a leadership kind of guy. Biden and Sanders decided to cancel their rallies last night in Cleveland, obviously, with as much caution as possible. And Donald Trump says he's going to Catholics in Wisconsin for Trump for a rally. Who got it right there?
I think Sanders and Biden did. You need the people who are leading to model the behavior you want to see. And the last thing you want to do as a candidate, whether you're incumbent or not, is have an outbreak tied back to your rally.
Who would you give high grades to? Amongst public figures, whether it's Newsom in California or Inslee or people on the White House, who have passed the leadership test in this crisis so far?
Well, I think that at the state level, I've seen a lot of good things. Newsom's done a great job in California. I think Governor Baker here has done quite a job as well. And thank goodness for Tony Fauci.
Why do you give high grades to Governor Baker?
Because I think he's been calm. I think he's been reasoned. I think we have had begin to see a proactive response, but it has not been a panicked response.
So you're in state government.
That's correct.
Do you give him the same grades that Eric does?
Well, I would agree. He's been rational. I would agree with the move to call for a state of emergency. And when I think about what we're doing in the legislature as we move forward, we've done three things. We've put some money into surveillance. Just a couple of days ago, we announced that the House and the Senate are going to move forward with $15 million to assist with these efforts as well. And the House has put together an internal working group to see what we can do with respect to legislating in the building.
But it seems to me, as a state, we have been more timid in shutting things down. I don't know if it's a good or bad thing. San Francisco, the Warriors are going to play in front of nobody in their next game because San Francisco said no crowds greater than 1,000. Move up to Seattle, which is obviously one of the epicenters. We know about that nursing home.
Well, I think there's been
crowds
evidence,
greater than 250.
Sure.
Ohio, I mentioned this last night. Governor DeWine said he's recommending no crowds at pro sports. They only have 4 cases there. We've got 92 or more. So did we go far enough? Or?
Well, I think we're getting there. I think what you saw on the West Coast is the fact that they have evidence of community transmission much earlier than we had. And as things have picked up with the Biogen conference, what happened there, and what's going on in Western Mass, Governor Baker decided to move forward.
Have we moved forward fast enough, though, here?
I think, again, we have not seen community transmission except in the Berkshires yet here, so we can trace back most of the cases, but I think we're very close to, I would love to see an NBA-level decision to say, here's what we as a league want to support, and across the other professional sports
I know
teams.
I'm a broken record on TV about this, so my apologies to you at home. My biggest problem with the handling across the board here has been the inconsistency. It's sort of like every boat on its own, or whatever that expression is, which, getting back to how your constituents feel about this, how confusing are you at home? One state does this, one does another. One event is canceled, another one's not canceled. Consistency across the board is an important part of assuring people that we know what we're doing, isn't it?
No, I couldn't agree with you more, and that's what the issue is at the federal level. We have an administration that has downplayed expectations, that has said within a week we'll have 1 to 1.5 million tests available, which is hardly the case, and which has completely botched the testing.
You know, I know one of your key words is trust. And speaking of the testing for a minute, for reasons that are apparently legitimate, even though troubling, both in the Berkshires and at Biogen, testing was delayed a few days because they didn't meet whatever the criteria were at the time. The president gets up and says there's a test for everybody who wants. When you promise more than you can deliver, obviously you don't establish trust. Where is the testing reality? Starting with you, Eric, where are we in Massachusetts and across the country in terms of everybody willing to get a test if they want it?
They were moving forward. There are more and more test kits available. I actually can't say I'm not fully sure. I'm fully sure of what the capability is.
But isn't that a problem in terms of leadership, by the way? When you can't answer the question,
Absolutely.
I can't either.
Well, it looks like there's 2 problems. The number of kits, but also the definition of what we will test.
Exactly.
And so
also the capacity to do the test.
Exactly, yeah. So initially when who was going to get tested, it was quite a narrow definition, right? It was folks who had certain risk factors, be it travel, be it exposed to someone with a known exposure to coronavirus. And now it looks like, I think since March 4th, the CDC has decided to broaden their definition.
Can a state public health lab keep up with what the demand is likely to be in your estimation?
Well, not immediately right now. And I think what the feds have done, they've really expanded the opportunity for the private sector to get involved in this game as well. Because there's no, I mean, the state lab can do it all.
So if all of you are right about starting with Fauci and beyond, our emergency rooms, for example, are we ready for what has potential to be an onslaught?
So look,
far
the emergency room where I work, it's the busiest emergency department in New England. We've moved forward. We've had hospital-wide policies with respect to travel for employees. We've just, in the last couple of days, have put a tent just outside the door to make sure that folks who are suspicious of being infected with coronavirus aren't going to come in and infect the healthcare workforce, because that would be a worst-case scenario.
One last thing about, again, I'm getting back to leadership for a minute. There's going to be rationing, I assume, if the numbers reach the point that most people are suggesting. Are we entitled to know, if it reaches that point, what those decisions are in emergency rooms in hospitals?
I think the more transparent we can be with people about who's being tested, why they're being tested, what the capability are, the more trust you build, the more confidence they're going to have in the system. It doesn't do any good to hide it and hope people don't guess or figure out what's going on. You've got to be transparent about it.
Do you know in your emergency room what the priorities are going to be and which patients are the priorities if they start streaming in?
No, there are protocols. I was just at the hospital 2-3 days ago to look at what the triage protocols are to see what we're doing at the management level. And so we're moving forward. We're drilling. We're expecting things to get worse before they get better.
Italy, they say they're taking care of young people first. Is that what the priority is going to be at BMC?
Well, I think the people who are most worrisome to get sick are the older people and to folks who have immunocompromised states, diabetes, underlying lung conditions. Now, the interesting thing with young people is that because they will experience the likely milder diseases, they're more likely to transmit it.
Yeah.
But it's just, just to remind folks that 85% of cases are mild. People will have mild symptoms.
We got to go. Doctor, it's good to see you, or good to meet you. I would shake your hand, but as you know, we don't do
We'll
that
just
now.
wave.
So nice to see you
Nice
both.
to see you.
Appreciate it.